And she looked at me and said, "Doctor, I know what you did. You saved my life and my baby." And I broke down and I started to cry. "What are you going to do now?" I said, "I'm going to be an OBGYN. He said, "Is that what you learned in the Navy with all these guys around?" And I said, "What am I going to do with this guy?" I said, "Well, who's going to take care of your wife and your girlfriends?" And the guy said, "Okay, go."
So, welcome back, guys. Today I have my father again, Dr. Mauricio Bitran, with me. My name's Dr. Mitchell Bitran. And today I wanted to talk about something special. I wanted to ask you, why did you become an OBGYN?
I grew up with a father that was a surgeon. And since little kid, I was in the emergency room with him. I was in his preparation for doing the first Latin American liver transplant in cadavers first, and in animals, and then in human. And that was at the age of 14, 15 years of age. And then going to medical school, I had a very difficult scenario where, because of a political crisis, simply I ended up in a poor hospital in my training, where one day I had to go into the OR, and my chief, that was the only two people that were there, went into another OR. I was 21 years old, and I was told, "Go and do the cesarean whatever way you can do it," with a third-year medical school that was assisting. And
so you were in medical school.
I was in medical school.
And the system in Chile is a little different, right?
Right.
So how does that work?
You do 5 years of medical school with 2 more of internship, and you become a family practitioner at the end. And but then I was only still in 5th year in this scenario, and I was 21. I walk into the room and I realized it was me, the 3rd-year medical student, and an assistant nurse. That's all what there was there. The anesthesiologist was in another case. I had to put the spinal, I had to set up the table for the surgery. And at that time, we were obligated, we're talking about 75, 76, and do an up and down incision. And I deliver the baby, I'm closing the mother, and my assistant fainted. And then trying to close as whatever way with linen. That's what we had, the fascia, the strong layer. The lady goes into, starts waking up because the anesthesia, the medication was not lasting long enough. I had to put pentothal on her to be able to calm her down and be able to finish up closing. And the poor lady goes and gets a laryngeal spasm. I wanted to die. And at the end, I had to get out, go and resolve the laryngeal spasm, get back again and finish up. And then the lady would not wake up. It would not wake up. It would not wake up until 2 hours later, she finally woke up. And she looked at me and said, "Doctor, I know what you did. You saved my life and my baby." And I broke down and I started to cry.
Oh my God. I can't even imagine.
I had my tears dropping down, and that really transfixiated me, because the truth of the matter, for me that I'm an emotional person, to be in an environment of very rough, dry people, doing surgery like a mechanic, and then dealing with the emotional part, the spiritual part, all what it means, this bringing a new life and being with 2 lives, mother and baby. And then I became confused, because all my thoughts were I was going to be a surgeon. And curiously, I went to the Navy, my first 2 years as a physician, around mainly men. And when I finished, I had to go to residency. And they said, what am I going to do? I went in front of the admiral in charge. And he asked me, what are you going to do now? I said, I'm going to be an OBGYN. He said, is that what you learned in the Navy with all these guys around? And I said, what am I going to do with this guy? I said, well, who's going to take care of your wife and your girlfriends? And the guy said, okay, go.
Oh my God. I can't even imagine. I'm sitting there thinking as a med student, especially the way we're trained now. I feel like we get through med school and we haven't seen a patient. We're just heads in the books for so many years. And then going clinical and saying, here you go, try to save this patient's life. Oh my God. I don't know how you got through that experience. And I can't believe such a hard experience made you choose. You must be so masochistic. It makes sense that you're 71 still delivering babies if anyone plugged you into this.
Right.
That's absolutely incredible. And what do you think are the main reasons because of that? Like what were the feelings? What were the emotions? What were the things that drove you? Because Papielli was a surgeon.
Right.
So you were saying it was more soulless. What were the feelings that pushed you towards obstetrics and gynecology?
It's very interesting. My father started doing OBGYN. In those times, there was no residency programs. The mortality on the mothers, because of the lack of any element of technology, was so high. And they were always mistreated because OBGYN was like in the worst part of the hospital. It came to a point that he realized that he could not grow in that environment. That's the reason he took on surgery. And he was doing both at the same time because you are a family practitioner. You were doing babies, you were doing adults and so on.
And surgery.
And surgery. And the curious thing is when I went to my father and I said, Dad, I think I have to go and do OBGYN. He said, I'm so happy for you. You're going to be my real continuity through that line of life. Instead of being upset that I was not following, because in the Navy, I went to the Navy hospital and I did a lot of surgery for general surgery. But that gave me some skills to do an OBGYN.
I'm thinking back to your story. You're a med student. I'm imagining right now, if I had to place a spinal in a patient, what exposure did you even have before that?
Some, but not much. It was so different at that time because we didn't have really residents in that hospital. We didn't have really just some few medical students, but this was right after the coup against the communist government that we had in Chile. And the people from that hospital, doctors and nurses, more than half of them, they disappeared. They were taken. Then they were with all these mothers delivering and not having enough physicians there. Then what we lived there was never repeated again.
Thankfully, yeah.
Thankfully.
Yeah. Yeah, it took, I remember you telling me previously, you trained through, was it Pinochet? Like you were in a military government.
I was first with Allende, the socialist government, and then with Pinochet. Right, those two governments.
Yeah. So how did that affect your training?
Tremendously. One, because in theory, many classes had been suspended. In practice, we had to do whatever we could do to help. Then we got to do more and probably had some areas there that we had to complement later on to be able to come up across. There were so many classes suspensions, there were so many strikes, and sometimes days without being able to go to school.
But still, I mean, a lot of you learn from the bedside, and I think that clinical medicine is something that is not the same as it used to. I think in some ways, even now, they have radiology being read by AI, which is an amazing thing. But at the same time, just through the training, doctors, nurses, they're going to the chart before going to their patient.
Correct.
So it must have, you must have learned so much with your hands, with just your history, your physical. And then seeing that now, how is your training different from your first to your second? Since you did have to do it again when you came to the United States at Chilean. Was it a similar system? Was it different?
Well, after the Navy, things were more stabilized there. Then I did my first residency over there. Ultrasound was starting to enter into a training. Fetal monitoring also was starting. When I came here, ultrasound and fetal monitoring were already ongoing. But I felt that we were forced so much to use the clinical judgment back there that I looked like kind of behind to people here because they, like you said, everything was laboratory interpretation. You could have an ER full of people with 2 or 3 people seeing patients. I would walk in and say, all the ones with respiratory symptoms here, all the ones with a GI symptom here, and all the chest pains in the center, okay? And I said, those guys go in first. This one, we give them prescription. The other one, prescription. Get out of here. And they almost threw me out because they said, hey, what is this? The people spending 24, 36 hours in the ER, some of them die there. Well, why? Because the paperwork, the medical legal situation. Then I had to learn the medical legal. I had to learn more about laboratory. And then I got in love with ultrasound because it's so useful. But people look at me using my hands and doing measurement with a tape, and they say, where did this guy come from? I don't want to lose the old skills.
And you shouldn't. They're so useful. And it's interesting saying that because that was in the 80s, correct? Just like
right.
Residency program. From there to now, you still had to rely on a lot more clinical skills than the way people are being trained. I feel like the nurses, the doctors, there's very little bedside teaching now.
Right.
Which goes back because we talked previously about things like Forceps. And I think that's a really unique skill to talk about specifically because it is such a hands-on skill to learn. And I did not have the most thorough Forceps training in residency, but I was really lucky that you were able to teach me, and I was able to get a little bit feeling more for that hands-on medicine, specifically in this case, telemetry, feeling how the baby's head was presented, if there was any asynclitism, how the head was positioned, being able to see, can get a 3D image in your brain of the relationship between the pelvis to the baby's head, and can we safely get this baby out vaginally? Being able to sit there and having you, for the first time, showing me how to do a forceps delivery, to guiding my hand to do it, to feel, to eventually now feeling pretty comfortable doing it. I wanted to talk to you about, in your first residency program, what was the situation? Because there, you ended up having to do your own anesthesia in medical school. So going there, when they didn't even have C-sections available, how were these skills taught to you?
Well, in my first residency, the first 2 years of the 3, we had to put our own epidurals and put our own spinals. The last year, we had to teach the anesthesia residents how to do it. And then they took it away from us.
I'm imagining me teaching anesthesia. Let me teach you how to do your job right now.
We're talking about 79, 80. And then 81, they started the residents of anesthesia to do this. And then they took over, thank God, because our job was to be focused on the mother. The other very important thing is, in the first 2 weeks of our residency, we had to really maximize our knowledge of pelvis. Every day we had a class. And then we had to have knowledge on the fetus at the end. about the concept of positioning and attitude, meaning sometimes they don't come out because they get stuck in an unusual position because their muscles are not strong yet.
You recently had that face presentation delivery.
And I had this baby that came out face first. Yeah, it was impressive because he was doing strange things and using the lips of the mouth. Right. And then once you become acquainted with this and they teach you, until I was able to do it right, I had a guy probably in their 40s or 50s that had to be with you doing what I did to you, putting the hands until they felt that the guy was really clear in his mind on what he was doing and when it was the right timing to do it, and when it was safer to do a cesarean, when it was safer to do the forceps delivery. And I said that forever. Until now, I have felt comfortable, and I try to offer other people to learn. But I found that, interestingly enough, that in my 36 years, the only people that were amenable was you and Dr. Tendler, our younger partner in the practice, that they were open to do it. But the rest of the doctors, they thought that they were not interested because they're scared of the medical legal situation and the patient's putting a front on you. No, I don't want it because it's going to kill my baby. That's a reality. But if you go to the Northeast, and you go to the Northwest, they're still doing it. They still teach it, but not down here.
Yeah. I remember you describing the teacher that you had that taught you the most. What was he like? And how did you learn from him?
Well, he was not an easy guy to talk to. He was pretty sharp and would not let you off the hook until you got the idea of what he was doing. And in truth, I am very thankful to him.
Where was he from?
Chile. No, he was from Chile. He had a German name, but he was German and Chilean.
Because I know there's different like British forceps, French forceps, and I know that a lot of the training was European-based. And when you had me read Denon's, where you talked about 4% C-section rate and all the crazy things that they used to do then. And
yeah. But we have to remember 50 years ago, 60 years ago, babies were much smaller. The level of obesity of today in our society, the way babies grow today, the pelvises don't grow. It's just the same mother with a lot more, heavy bodies. Then what happened, these babies, sometimes they can't come out. In those times, the babies will get into the pelvis before the labor and they will be almost ready to come out. Not anymore.
It's also a lot more of a homogeneous population.
Correct. Yeah.
And I'm thinking about one of my friends. He's like 6'4", and his wife is Asian. She's like 5'2". But that's... And you see a lot more of that, but now we get these babies out healthily. That's the reason why C-sections exist.
Right, Miami is a melting pot. Yeah. We're all mixed from everywhere.
But we still are able to use the forceps with a lot of these patients that otherwise would not be given a vaginal delivery.
Correct.
Yeah. Amazing. Good. This was an awesome conversation. Thank you guys for listening. Hopefully I can get more amazing stories out of my father, Dr. Mauricio Bitran, and we'll see you in the next one.